Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of subacute thyroiditis. In the clinical features, first we have these. Okay, so clinical features of subacute thyroiditis. In subacute thyroiditis, you will see that there is painful enlarged thyroid gland will be seen, and this painful enlarged thyroid gland is seen because it is combined with pain. It is always associated with fever. Here, the patient will have features of either thyrotoxicosis is seen, especially in the initial stages. Later, the patient will have hypothyroidism. Actually, it has four stages. First stage is hyperthyroid state due to the release of hormones. Then there will be euthyroid stage followed by hypothyroidism and resolution going back into euthyroid state. So based on the state, we see features of hypothyroidism and hyperthyroidism. And you can also see that the symptoms of upper respiratory tract will precede this disorder within some weeks, and the patient will present with complaints of sore throat, and also the tender goiter is seen in these patients. The pain is sometimes referred to either the ear or the jaw. Then in these patients, in subacute thyroiditis, complete resolution occurs usually complete resolution occurs usually in this subacute thyroiditis. Then permanent hypothyroidism can occur, but it is more less common. But this permanent hypothyroidism occurs if it is associated with any thyroid autoimmunity. Then permanent hypothyroidism can also occur. Then if we see the laboratory findings, obviously the laboratory findings depend upon the stage. Actually, first and foremost, ESR is elevated in subacute thyroiditis. ESR is elevated in subacute thyroiditis, followed by, if you do a thyroid scan, you will see that in the thyroid scan there is thyroid antibodies are seen low. So thyroid antibodies are low, but T3, T4 and TSH mainly depend on the stage. These will depend on the stage. That is, if it is a hypothyroid condition, then TSH will increase and T3, T4 decreases. If it is an hyperthyroid state, then T3, T4 increases and TSH decreases. And during this hyperthyroid stage, the radioactive iodine will decrease. If you have any doubt, you can do an FNAC. On FNAC, we can see that there is characteristic giant cells, multinucleated giant cells are also seen. Then treatment of subacute thyroiditis. If the patient has subacute thyroiditis, mostly the patient is primarily symptomatic. The patient is primarily symptomatic, and the disease in most of the cases it is self-limited. Aspirin or other NSAIDs can be given to control the disease in most of the cases. If severe cases, there can be marked, if the patient is a severe case with marked local symptoms, in those patients we need a glucocorticoid treatment can be given. Sometimes even the short-term thyroid replacement therapy can be done, especially in the hypothyroid state, because always thyroid hormones should be normal for the normal functioning of the body. So as a result, we have to give short-term thyroid replacement measures are necessary for hypothyroid state. Thyroidectomy, though done in rare cases, but it is done in rare cases when there is prolonged course, when the patient require prolonged course of medical treatment without any response. That is, if there is no response to medical treatment, then thyroidectomy can be done in the patients.
thank you and thank you for watching.